I'm Dr. Bruce Campana. I'm one of the physicians at the hyperbaric chamber at Vancouver General Hospital. In a year, on average, we'll see 10 to 20 carbon monoxide poisonings here at the hyperbaric unit. There's a seasonality to CO poisoning in that we tend to get more cases in the winter when people are burning fossil fuels. Carbon monoxide poisoning originates in a variety of ways. One of the commonest ones is people burning fossil fuels for heat. It can be wood, it can be propane, it can be natural gas, it can be gasoline. We also see it from other things such as pressure washers or malfunctioning heating sources. We see it from generators. We see it from automobiles. In the fall and winter months, we tend to get carbon monoxide exposure from sources of heat. One of the ones that we see would be somebody brings a barbecue inside, which sounds like a great idea. You cook inside because it's lousy weather and you heat your home. It's a really bad idea because that will give off carbon monoxide, and we've seen people in trouble because of that. The other thing that we'll run into is people using generators. Winter means storms and power outages, and people will put a generator, they don't want to leave it out in the rain, so they'll put it in the garage, which is also a bad idea. It protects your generator, but it puts carbon monoxide into your garage. And most people don't know that carbon monoxide actually can go through drywall. So you're isolating your generator in your garage could be poisoning your whole house. Most people have heard about carbon monoxide, but they don't really know the important details about it. They may not know that it's colorless, they may not know that it's odorless, and incredibly difficult to detect. Some people think that natural gas doesn't produce carbon monoxide. That's wrong. They think that propane doesn't. That's wrong. Anything you burn that's carbon-based will produce carbon monoxide. Carbon monoxide is a poison that works in different ways. It displaces the oxygen in your body, so you can actually die of lack of oxygen. But it's also a poison that works on your body. It can work on your heart and it can work on your brain and give you permanent damage in both organs. Carbon monoxide poisoning will usually show up as dizziness, nausea, headache, a feeling of malaise. Unfortunately, it's very similar to a lot of viral illnesses, which makes it hard to tell apart. One of the challenges of carbon monoxide poisoning is trying to tell it from a viral illness or food poisoning. And it's sometimes virtually impossible unless you do blood levels. But if you've got a building where maybe there's 10 people in an office and they all get sick at once, I'm worried about carbon monoxide poisoning. If you've got an old ski cabin and you've got propane heat or an old fireplace and people start getting sick, I'm worried about carbon monoxide poisoning. Carbon monoxide poisoning can appear in a variety of ways. It can be gradual if there's low concentrations and you may have some mild malaise and that mild viral illness feeling, all the way to sudden death, where there's high concentrations and people just black out within a minute of exposure, and everything in between. Most people don't know that carbon monoxide poisoning can have very, very bad long-term effects, and those effects usually involve the brain. And it can involve things such as emotional changes, intellectual changes, cognitive problems that unfortunately don't go away. Recovery from carbon monoxide poisoning can be as simple as going out into the fresh air and feeling better. It can get more complex if somebody's brought to the hospital where they might need some pure oxygen for a while. And in bad cases, we have to put them in the hyperbaric chamber for hours at a time, sometimes several times in a row, in order to get rid of the carbon monoxide and try to reduce the amount of damage that occurs to the brain. People find out about carbon monoxide poisoning in different ways. Some people just feel unwell and they go to see their doctor and the doctor puts together that this might be carbon monoxide poisoning. Some people are in a crisis. They might collapse and an ambulance is called and they're brought to the hospital and it gets detected that way. One of the most common ways is that a carbon monoxide detector goes off, and that means it's doing its job. And people hear a carbon monoxide detector, they'll either respond and get out and get fresh air and maybe go to the hospital, or they'll do what we hope they don't do, which is that they'll think there's something wrong with the carbon monoxide detector and they'll turn it off. Everybody is at risk for carbon monoxide poisoning. The people who are most at risk for problems associated with carbon monoxide poisoning include the elderly, those with respiratory or cardiac problems, and pregnant women. Elderly people in particular are at risk for problems with carbon monoxide poisoning. And it's because they often have a lot of other illnesses. They just don't have the reserve that a younger person would have to resist some of the poisoning effects of carbon monoxide. We also worry about pregnant women with carbon monoxide poisoning, and it's not so much the mother, it's the fetus inside. They are more susceptible to damage from carbon monoxide poisoning because of a difference in the hemoglobin of fetuses. If you've got somebody that you're worried about carbon monoxide, or even somebody that's acting in a bizarre way, then the safest thing to do is get help. Call 911, because you don't know if it's carbon monoxide or a drug-related problem or a mental health issue. What you're clear on is that there's something wrong. Call 911. If I were to pick out the single most important thing about carbon monoxide that I want people to know, it's that you should have at least one, and ideally two, carbon monoxide detectors in your home. And I would say two because people often turn off their carbon monoxide detector because it's beeping and they think there's something wrong with it. Having two, if they're both going off, it's pretty hard to argue that you're in danger. If your carbon monoxide alarm is going off, the best thing to do is get everybody out of the house. If you have time, turn off appliances, open windows, but get everybody out, including pets, and call 911.